are on page 857, musculoskeletal. We are doing injuries versus fractures. Okay, ready? Yesterday, we said that we have injuries, right? We talked about that yesterday. And we have fractures. Okay, now, injuries, yesterday we said that injuries, right, not a break in the bone. There are two types you need to focus on. Strain and sprain, right? So that is recapping from yesterday. Strain and sprain. Yesterday I said you strain your muscle, you strain a tendon, right? Strain, right? What is the nursing intervention? A patient that strained their muscle. Ready? Ice, 20-minute on. Heat, 20-minute on, 20-minute off, plus NSAIDs, muscle relaxers. So yesterday we discussed the muscle relaxers. We said we had Lirasil. We said we had Soma Corispidol. We talked about ibuprofen, and we said that anytime a patient is taking NSAIDs, ibuprofen, right, you want to watch for GI bleed. Now, sprain, you sprain your ankle. You sprain a ligament, right? So, nursing intervention for sprain is RICE. RICE. R for rest. R for rest. Ice. Cold. I for ice. C is compression. Mali. C is for compression, and E is to elevate it. So remember, right? RICE for sprain. What page? Miss Sonia is on page 857, injuries versus fractures. Now, so injuries is recapping from yesterday. Now, we are on fractures, right here. Fractures. Fractures, a break in the bone. Zokasi, a break in the bone. I am on page 857, B5, and you see some green diamonds. So remember, the green diamond, the author is saying, hey, you, if I was you, I would read this. You see the green diamonds. So every green diamonds that you see in your book, you need to put NCLEX because that is very important. Every time you see a green box in your book, you should put NCLEX because that is important. Because anytime an author has something important to say to a student, they put it in boxes, they make it very bold, they make it student friendly, right? So you're able to understand. So ready? I see a green diamond. So that green diamond means, hey, you. If I was you, I will read this because this is very important. So I see a green diamond. All right? So now let's turn. So we did 857 injuries. You need to highlight that. Then fractures, you need to highlight that. That means you're going to read everything that falls under fractures. True? Turn to page 858. I see a box. There you go. The author is talking to you. Hey, you. I see a box. If I was you, as a student, it is imperative that you know this box. Now, types of fractures. That's a box. So you see a box. So you're going to put NCLEX on that because there's a box. Now, so let's talk about the different types of fractures, right? Now, the first type of fracture, I want to focus on a fracture that is called the green stick. Highlight that. Green stick. Green stick fracture is a fracture, a bone that is broken on one side, right? And the other side is bent. You normally find that in children. All right, mute, and that is normal. All right, so make sure you highlight that. Now, the next type of fracture is what we call pathological fracture. Pathological, some type of disease, right? So, for example, I have multiple myeloma, all right? Cancer of the bone, right? That causes fractures. I have osteoporosis, right? So, when you see pathological fractures, right? The patient have a broken bone due to something else. Highlight that. All right, so in that box, I want you to highlight green stick. I want you to highlight pathological fractures, and you should be able to know what diseases cause pathological fractures. Diseases such as osteoporosis, multiple myeloma, there are other diseases, hypothyroid, all right, and also when patients are taking certain medication, such as hydrochlorothiazide that causes hypercalcemia, right, causes bone issues. Now, the other type of fracture, which is the last one, is called spiral. Spiral. So remember, you know how my name is Sonia? So spiral is like an S. Now, anytime you find a spiral fracture, please equate that with abuse. Abuse. So put that, abuse. And you guys know, anytime you suspect children are being abused, you must report. Elderly being abused, you must report. Pregnant women, you must report. So remember, spiral fracture, spiral S, and also if you see this terminology called in circles. In circles. So types of fractures, I need you to know green stick. I need you to know pathological fractures, and I need you to know spiral. Anytime you see spiral fracture, the way I want you to think abuse, you must report. So, let's recap a little bit because I said a lot of things. Ready? I told you fractures, a break in the bone. The type of fractures are, ready? We said green stick. So if you get a question, how do you document a patient have green stick? Document, continue monitoring. Don't call that abuse. That is suspected in children. Pathological fractures. All right, what disorders cause pathological fractures? Multiple myeloma, osteoporosis, medications such as hydrochlorothiazide, because remember, if it causes high calcium in the blood, that means low calcium is in the bone. So the patient is at risk for fractures. So that is mute. Darsha, Juliana, please mute. Okay? Thank you. All right, so highlight that. Now, box, page 858, box 58-4. This is very important. How do we fix fractures? There's another box, so I don't have to tell you. Anytime you see boxes, the author is saying, hey, you, if I was you, I would read this box because I told you. Anytime the author has something important to say to students, right? Because you know students don't like to read no ways, right? So the author will put it in a green box. He will make it bold. He will put some green diamonds. Hello, that is a sign, okay? So I see another box. It's 58-4. So if I'm reading this book, I'm going to put NCLEX. We fix fractures 4 ways. 4 ways. Ready? Reduction, highlight, fixation, traction, and casts. Again, we fix fractures 4 ways: reduction, fixation, and cast. What is reduction? Another name for reduction is called alignment. Ou konen les Haïtiens di, rale dom pou mwen, mgon gaz, tout problem yo se gaz. Rale dom, mayen dom. Now remember, reduction is like alignment. So the patient come in like this, right? You know, one broken bone. So a lot of times, if the patient is in so much pain, they may give the patient a shot of lidocaine. A lot of time, the pain is not that bad. So while you're talking to them, you just click alignment. All right? So reduction is alignment. Okay? Trying to get the bone back to proper alignment. All right? That is reduction. Simple. So again, box 58-4, we fix fractures 4 ways. What is fractures? Right? A break in the bone. Now, the second way is fixation, surgery. Fixation, they normally put a metal to hold the bones together, right? The broken bone. So fixation is surgery. Hey, you a nurse, you don't do surgery, but you need to know post-op for this patient. So fixation, right, I'm on page 858F, involves the application of screws, plate, pins, rods, right, to hold the bone. And you have a picture in your book. Listen, so a patient had some form of fixation, a metal in the bone. If I'm trying to ask a student a question about this, what question can I ask you? Number 1, this patient is at risk for infection. You better know that. So after surgery, if this patient have a fever, right, you're going to monitor temp, you need to call the physician. Remember, you don't do surgery. We got that. But at least you need to know, you know, after the patient get these rods and metals to hold the bones together, what's your job as the nurse, right? So that patient is at risk for infection. And that you learn in fundamental pre-op, post-op. This patient cannot get an MRI. Anytime you have metal, plates, rods, this patient cannot get an MRI, right? Now, what happened after surgery if this patient don't get up to ambulate? The patient is at risk for DVT. So we fix fractures 4 ways: alignment, right, which is called reduction. Fixation is surgery. So you know the questions they can ask you about a fixation are all pre-op, post-op questions. So that is simple. So far, we've learned that we fix fractures 4 ways, and we did 2 of them. Alignment, which is called reduction, and fixation, which is surgery. Simple. Now, the next one. That's the one that students always have problem with. And we call this the traction. And there are different types of traction. So, going back to the book, let's go to page 859. You see some pictures, right? You see picture A, picture B, picture C, picture D. All you see is pictures. So what happened with students, when they see pictures with no words, hey, I don't need to study this because there's no words. Wrong. You need to know about traction. As a nurse, if you're working on the ortho floor, which I think from working in the ortho floor, right, that is the hardest floor you can work on, honestly, because when you get there, that patient is on all different type of screens. You don't even know where to touch, right? If you work 3 days straight on the ortho floor, you know how you work 12 hours, honey? You sleep for 3 days because it's a lot of work. But anyways, let's talk about the traction. All right, I'm on page 859. Let's look at picture A. Everybody, page 859, picture A. Now remember, there's no words. All right, so you got to take notes by each picture. We're going to first talk about the weight. So everybody see the weight. Weight laissez-faire, the metal. Everybody see the weight. Then we're going to talk about the bed, and then we're going to talk about the patient. Again, going over these traction, we're going to talk about the weight first, then we're going to talk about the bed, and then we're going to talk about the patient. Okay? These are methods on how you fix fractures. All right? We said we can, doctor, not you. Ready? They can use reduction technique, they can do fixation technique, and they can do traction. And we are on traction. Picture A. Picture A is called Buck's traction. So that means you're taking notes. Don't say, where is it? Is it in the book? No, you're going to look at A and you're going to take notes. Buck's traction. If you don't know how to spell Buck's traction, if you go to figure 58-2, you will see Buck's traction. It's right there for you. Let's talk about the weight first. The weight can never touch the floor. Write that. The weight can't never touch the floor. Why? Because if the weight touched the floor, then the alignment changes. Now you're messing with the prescription. All right? So the weight can never touch the floor. So if the CNA or if the patient have a visitor and the visitor sit on the bed, what happened to the weight? The weight touches the floor. So you must intervene. Number one. So we talked about the weight. The weight can't never be more than 10 pounds. So it's 8 to 10 pounds. So you remember I told you I'm going to talk about the weight, then I'm going to talk about the bed, then I'm going to talk about the patient. All right? Now, so no one can sit on the bed because now you're changing the alignment. All right? The degree, and I'll talk about that. I told you the weight cannot be more 8 to 10 pounds, cannot be more than that. Now, if the patient is saying, oh my God, this is so heavy. Oh my God, I can't take it. You need to call the doctor. You are not to add weight and you are not to delete weight without a doctor's order. All right? So you need to call the physician. So that's the weight. Now, let's talk about the bed. The bed. The bed, you should never have a pillow. Anytime a patient have a Buck's traction, you see how the bed is flat? If you put a pillow, elevate the patient leg, now you're messing with the alignment. Okay? So no pillow. Which one you will intervene? When the CNA say, I'm going to go put a pillow under Mr. Lee's leg with a Buck's traction. Now the alignment changed. So no pillow. You see, the bed is flat. Okay, so bed flat. Weight never touched the floor. Now, how many degrees? Okay, now some book, different med-surg books have 30 to 45 degrees. Others have 45 degrees. So what I want you to put, just put 30 to 45 degrees. Just stick to that. Because different med-surg book put, some have 35, some have 40, some have 45. Just put 30 to 45 degrees. Now, who determined the degrees? The orthopedic surgeon. Now, the bed is flat. Look at what's under the patient's foot. Look at the patient's foot. What is under the patient's foot? A what? What is that called? A board, a footboard. The purpose of the footboard is to prevent foot drop. So suppose you don't see a footboard and you see high top sneakers. You better take that. Converses. You guys know what Converse is. Haïtien, tennis bottio. Nous connaissons tennis bot. So when they say like the Converses, the high top, so the patient always have to have a footboard to prevent foot drop. Okay, so now we in the patient. Listen, what's priority for this? Now remember, we did the weight, we did the bed, and now we focusing on the patient. I want you to think. The patient is in bed and they can't move. Meaning they can't ambulate. They're not walking. So they're in bed. Think. You got to bring the bedpan to them. You got to come and talk to them. Because that is a form of isolation. I'm not moving. Oh, Jesus. Can somebody come talk to me? Can somebody bring me water? So you guys need to know that. So the priority for this patient is to keep this patient hydrated. See, anytime you're not hydrated, then you have skin breakdown. So keeping me hydrated help the skin with moisturizing, right? So priority for this patient is skin, keeping the patient hydrated. Keeping the skin dry, all right? Nice and moist, all right? So that is picture 8, bucks traction. Now, all you guys have your books. Do you know a student will never study these pictures because there's no words? They just skip this whole page. I'm not doing it. Well, whatever. I don't see any reading. Yes, you need to know the different types of traction. Then we have B. This is what we call Russell traction. Now, same thing with the weight, same thing with the patient, same thing without putting no pillows, but this degree is 25 to 29 degrees. Some books, med-surg books, have 25 to 27 degrees. That is called a Russell traction. See, and a lot of times the students don't know the difference between Russell, Bucks. You need to know the different types of traction. Okay? We put patients in traction. That is a method, a way to fix fractures. Picture C. Picture C is what we call head halter. And we talked about this in neuro.
Sorry, please, the difference again. I didn't get the degrees.
I don't understand the question.
I mean the difference between the box traction and the
The
Russell
Bucks
traction.
traction and the Russell traction, it has to do with the different degrees. One is 45 degrees, right? One is, I want you to remember, between 25 to 29 degrees for the Russell. Okay? Head halter, everybody know, it's 30 degrees. Now, look at the head halter, right? Another name for this one, the head halter, right? They call it cervical traction. Look at what is under the patient, the back of the neck, and also the chin. You see a padding. The purpose of the padding is to prevent skin breakdown. Okay? And it's 30 degrees. Now remember, in neuro, we talked about autonomic dysreflexia, which is a medical emergency. Anytime a patient hit their back, they need to be immobilized. You bring the patient to the ER and the patient have high blood pressure, right? That means that the patient can hit their spinal cord from T6 and up, which is a medical emergency, and priority for that patient is to put a Foley. Now remember, so anytime a patient hit their back, spinal cord, okay, this is how you will position them, right? They will come in, right? Right? And then make sure skin breakdown, same thing. The weight, 8 to 10 pounds. Never put a pillow. Look at there's no pillow under the head. No one should sit on the bed. Priority is skin. Keep the patient hydrated. Turn the patient frequently. Keep the skin nice and dry. You don't want skin breakdown. Now, so that's picture C. So we talked about A, B, C. Now, the last type of traction is what we call tibial pin for skeletal traction. That is the guy, the bottom picture. You see this guy broke every bone in his body. You see that? So it looked like he'd been in a major motor vehicle accident. Now, pin en créole, ti fait. Right? Pin. Pin. P-I-N. Metal. So let's talk. Turn the page. You're going to turn the page to page 860, number 2, intervention. And there's a diamond. So there you go. There go a diamond. So what is the author saying to you? Hey, you. If I was you, dear students, if I was you, I would read this because you may see this again. See, that's the author speaking to you because he put a green diamond next to it.